All right.
Yeah.
Also with us this half of the show is Alex Hong, chairman of the Hong Kong New Emerging Technology Education Association. Good morning.
Yeah, good morning.
Presumably your members are interested in the app. What's happening there?
Okay. Okay. The first thing is about the tracing app. I want to actually I have a suggestion for the government, the Hong Kong government before in these few days. Actually, we can technically, we can make sure the public. Okay, now the problem we are having is whether our information will be released to the Hong Kong government, because all the people in Hong Kong are concerning about our privacy, and but what we wanted to have the virus tracing app. In fact, we can make sure the government doesn't know, really doesn't know where actually we have been, and how we can develop such app, because we don't have a lot of time, and actually we can rely on some successful application in other countries, and it will make our development time shorter, but of course we really our Hong Kong government to adopt this approach, because if we try to develop something which is we haven't built before, because I'm from IT background, we will have a lot of technical difficulty, and also such as in France and also in Australia, they have a bad experience that if your app that the first time is not very good to be deployed, and the citizens will be reluctant to install it.
Well, surely any app depends on the willingness of the vast majority of people to download it in the first place.
Sorry, your question is?
Well, you can have the world's most perfect app, but if the citizens of Hong Kong don't download it onto their phones, then what have you got?
Actually, in our technical world, we have something called open source development, and in fact, I did some research. In fact, in Germany, there's an app called Corona One, and which is quite good in terms of the idea and also the technology. And now about 1/5 of the population in Germany, they have downloaded this app, and it's quite successful. And in fact, I want to tell more about how it can help, and how to protect the privacy of the public, and also at the same time have the tracing of the virus. In fact, the use of the technology of Apple and Google to generate identifier, which is we will change in 10 to 15 minutes in every mobile phone, and then this code, this identifier will be make use of the Bluetooth low energy transfer to work between different mobile phones. And then if you download the app, and then all the people with mobile phone can exchange the code, when they exchange the code, the phone will do it automatically. All the people, they use the phone, they do not know they exchange the code. And these codes will change in 10 to 15 minutes by using hashing and some technology, and then no one knows what the code are, and all the phone will do this thing in the decentralized mode. Once we have one case, for example, you have one person is not lucky, and then got the coronavirus, and then he voluntarily upload his certificate of having this virus to the app, and then the app will send this information a central server will send a message to over the phone, which download the app, and then let them know this person with this identity in the last 14 days with this possible virus.
It sounds good. I mean, has it proved useful? Has it worked in other places?
It works in Germany.
Okay, and this is just
the problem is that you need to have many people. They are willing to download the app.
Yeah, sure. And you said maybe a fifth of the population in Germany. So this is available. What you could just get this from the App Store anyway. Could you? Is this available now?
Yeah, it's available, but in German. Okay.
Okay.
And the language is in German. But if Hong Kong government they really want to develop the app, actually, as I know from the source, they are now having a tender to invite some companies or universities to develop. But if they develop by themselves or by a company, okay, it may take time. Okay, after tendering process, the Hong Kong government, they have the tendering process. It takes around 1 to 2 months, and then take another 2 to 3 months to develop and then to deploy. And at that time, maybe it's by the start of mid of 2021. Okay, we don't need the app.
Yeah, I know about that, Mr. Hong. I'm a civil servant. Okay, Benjamin Cowling, what do you think of the idea of the app?
So there are these two different approaches. There's the decentralized approach, which we just heard about with Apple and Google, used in Germany, used in other countries. The responsibility there is on the individual. So if you or me install the app, we can receive updates about whether we might have been exposed to COVID, and we can voluntarily decide ourselves whether to quarantine at home because of that information. The government has no involvement in a decentralized app. But what's being talked about in Hong Kong is a centralized approach where the government has a database on all of that information. And that's what, in many other parts of the world, people have been not that enthusiastic about, because they're not enthusiastic about the government knowing where they've been, what they've been doing, having all of that information stored on a database, which then might also be vulnerable to hacking and other issues.
Okay, a couple of questions from listeners. G says, could one of your guests explain exactly what the proposed method of mass testing in Hong Kong will be? I understand that even with nasal swabs, there are different methods of collection and from which spot in the nose. Also, the suggestion of pooling 3 to 5 samples and then testing appears bizarre. Does any other place use this method, and how is it possible to determine exactly who out of the 3 or 5 persons is infected? What other place pools samples? So 2 questions there from G. Professor Cowling, first of all, the method of testing?
For the first one, we're still waiting for the fine details of the proposal. It could be a nasal swab or it could be a saliva sample. Actually, a saliva sample would be an easier thing to do and require less manpower. For the second question of pooling, it's actually a really good idea. So the concept is like this. If you want to test 7 million people, you first get all the samples and then you put them in batches of 10 and you do 700,000 tests instead of 7 million tests. And a small number of those 700,000 tests will come back positive because one of the 10 people in those pools had COVID. And then you do a second step. You go back to the original 10 of those positives and you test each one to see which of the people was positive. And if you're only expecting 100 or so of those pools to come back positive, then you do 700,000 tests plus another 100 or so. And that's how you find the positive individuals. It's a much more efficient approach than doing 7 million tests. And it's been done in Wuhan when they did 10 million tests, you remember? It was done in Beijing. It's done in other parts of the world as well. It's a really sensible idea for mass testing, but you need to be careful not to do too much pooling. If you go 10, 20, 30 samples together, you lose a bit of sensitivity, and maybe you miss some people with COVID with low levels of virus.
Interesting. All right. We also had, I remember last week talking to a microbiologist who was concerned about the quality of the testing, that this mass kind of testing might not be done very well, and that would have a negative impact. Professor Cowling?
I think we recognise that mass testing might not identify every single infected person at the point when the test is done. maybe it wouldn't be 100% perfect test. At the same time, if you can pick up most of the people who are infected, particularly the people with high levels of the virus, who would then maybe be more contagious, I think it's already going to help a lot. So in that sense, it's okay. But as I said before, the idea of mass testing, it's an enormous amount of work to find a very small number of infected people, and there might be other more efficient ways to find those same people.
All right. Peter T says, please ask Dr. Cowling whether the current restrictions of only 2 persons being allowed to eat together in a restaurant is significantly more effective in viral control than if it were relaxed to 3 persons. This would allow the smallest size direct family of parents and 1 child to eat together in a restaurant. Current restrictions seem guaranteed to destroy the restaurant business as well as make family feeding very difficult if both parents have full-time jobs. That's from Peter T. Any comment on that?
I don't understand the restaurant measures. I think that there's not a lot of public health rationale for saying 2 people, but not 3 or 4 or 6 or 8. I think the more important thing in restaurants is to space out the tables and to reduce the total capacity. Maybe a 50% capacity limit is the important thing, not the number of people sitting at one table.
Okay. Mike says, finally, on testing, finally someone gets it. I've been trying to tell you for the past 2 weeks, stop spending outrageous amounts of dollars depending on mass testing. Stay locked down too much longer, lose your job, and you're going to see suicide levels skyrocket. That's from Mike, who also says, I really like to join intelligent conversations. Maybe I'll try again, another topic, another day, LOL. Lockdown all people's homes, that's where more than 50% of the fatalities come from. Thomas C. in Macau says, good morning from Macau. Here we follow the developments in Hong Kong. I've heard a lot of talk about developments of apps that need to be downloaded. I can see that as a privacy problem, as it is easy to have an app stream personal information and location data if the developer intends it. In Macau, we use a government website. There's a link to that. No apps used. You take a daily screenshot of the QR and you are good to enter all buildings in Macau. That's from Thomas C. Do you know how that works, Ben Cowling?
I do not know the details of that, but it sounds a little bit like what's being used in mainland China.
Okay, so that's the centralized one you're talking about.
But the problem is that Macau is much smaller. Geographically, it's not easy to apply in Hong Kong as well, and also the privacy law in Hong Kong is different from Macau, and I don't think a centralized approach can be applied in Hong Kong.
Okay. Gloria says, I think social distancing measures should continue until 0 infection cases recorded for some time. Mass testing is not necessary because we're not locking down the city and the problem cannot be contained. Moreover, the testing isn't mandatory. Jay says, Google already tracks my phone and has all my personal information. I'm sure someone's government or police are looking into my life. I only have to look up a few specific wrong words, like how to make guns, bombs, drugs, and the authorities would be on to me. That's from Jay. Also says, why is the government not promoting clear, full face masks to cover the eyes and stop the droplets? Redesign. Then we can all go to restaurants and eat and drink. The main transmission is social, business, and home, but we need to keep society running. And Paul Zimmerman says, mass testing is good, but focus the application. Building our testing capacity is a good thing. The capacity should first focus on every person which crosses our boundaries every time they cross. That comes from Paul Zimmerman. I think that's the last comment we have from listeners just at the moment. Alex Hung, I mean, what's the experience overseas? Have people found that technology can help, that these kind of measures, whether it's a centralized sort of health code or an app or something like this, are they of use? Are they popular?
You mean that it's popular in other countries?
Yeah.
In fact, okay, what I suggest is a decentralized approach, okay? I do not think a centralized approach can be supported by the citizens in Hong Kong. In fact, if we make a centralized approach, and all the people will not download the app because they do not want all the people to track where they have been and which restaurant or which bar they have been. It doesn't work. But in fact, for the decentralized approach for the app in Hong Kong, actually I suggest to the government, so we use it mainly use in taxis and also restaurants and also in other public place they have visited, just like the shopping mall. Whenever they went there and then they use the app, and then what I suggest about the anonymous identifier by using Apple and Google technology, and then have the tracing of the people. And then, for example, if in the last 14 days, I need to ask myself where I have been in the last 14 days, it's not easy. But by using the technology, you can have a track of every people or every person they really want to know. Okay, of course, it's an option whether you want to be tracked or not. Okay, and if I really want to know where I have been in the last 14 days, or which people I have met before, and then if one of them have the COVID-19, and then I really have that information, it's so much easier to have the whole idea. Okay.
But Mr. Hong, if we're going to do a decentralized one, why don't we just buy the German one and translate it into English or Chinese?
Yeah, actually, we need not buy the app. Okay, we can use the open source development. Okay,
right.
In case of now, okay, if the government is now hiring a company or an university team, after have the tendering, and then they can make use of the open source, and then to have a localization into maybe in the English and Chinese, traditional Chinese, and then use in Hong Kong is much more efficient than develop the new thing. Okay, and it takes the time is the shortest one. But actually in Hong Kong, because traditionally we don't use open source a lot, and of course I really suggest to have this approach, but I can only suggest, but we can't change it.
Okay, an email from Rick who's put some links in. I think the point is in relation to limiting 2 people at a table, that the legislation has exempted group gatherings, and one of the exempted group gatherings is group gathering of persons living in the same household. So that would be families. I don't know whether that actually applies to restaurants and so on. There's a link from correspondence to a private club. I think
the clubs are very strict. It's 2 people a table and a gap between them.
Yeah. As are restaurants, that I've went to over the weekend. Benjamin Callan, the other thing, speaking of other places, was what's happening in New Zealand? Do we know what went wrong in New Zealand, and what can we learn from it?
It's very instructive, because they were doing so well. They kept the virus out for quite a long period of time, but then somehow the virus got back in. There's this suspicion that it might have come in on frozen food in some way. I'm not really convinced about that. I think it's more likely that there was an unrecognized infection, maybe a really long incubation period, or maybe something happened that nobody could anticipate. Infections got into Auckland and then started spreading, and now there's more cases being found every day. They're going to have a little bit of trouble staying on top of it, as we found in Hong Kong with our 3rd wave, but I think they will manage to bring the epidemic under control and eventually go back to their elimination strategy. But I think it's the same in Hong Kong as well, where we had a period of time with no local cases, but then the virus found a way in, and it will find a way sooner or later, and then you have this outbreak when people are acting as normal, if you like. And for Hong Kong, the lesson is then, even after this 3rd wave is over, after we have a period of time with 0 local cases, we may return a little bit more to normal. Maybe we can have larger groups going back out to restaurants again. Restaurants can fill up, beaches can open, clubs can open, gyms can open, etc. But sooner or later, the virus will come back again, and we'll have a 4th wave. I think that's very clear now. I think when our 3rd wave started, some people were a little bit surprised, but no one's going to be surprised in a few months' time when we have a 4th wave and then a 5th wave and so on. And that's going to continue for another 6 or 12 months.
Until we get the treatment.
they get the vaccine, which is maybe next summer.
Okay, and they didn't do anything wrong in New Zealand. It's just
I don't think they did anything wrong. I think they did really well, actually. It's difficult to keep the virus out indefinitely. It will find a way in sooner or later, and once the virus is in a population that's not having social distancing measures, it will be able to spread.
All right. One of the disturbing facts that came out in the first half of the show was the very large number of people in Hong Kong are exempted. Dr. Kwok mentioned 300,000. That's
exempted from what? Sorry.
Exempted from the quarantine. They can go backwards and forwards.
Yeah, that's right. So I think that is most likely the loophole that allowed the third wave to begin. But even if those people had not been exempted, there would have been economic consequences, and we still would have had a third wave sooner or later. So I don't exactly blame the loopholes, because we understand the virus. There will be opportunities for the virus to get in sooner or later, if not through one of those loopholes, then through maybe someone with a long incubation period, someone who's in home quarantine with their family, and they pass it to their family and spread it out into the community. There'd always be opportunities for that for infection to get into the community.
Okay, well, Professor Cowling, many thanks for joining us once again. Head of the Division of Epidemiology and Biostatistics at the Hong Kong U School of Public Health. Thank you very much indeed. Alex Hong, Chairman of the Hong Kong New Emerging Technology Education Association. And Mike Rouse, many thanks to you.
Fourth wave, fifth wave, sixth wave. We'll be talking about this for another year.
Give us a break. The weather forecast: a few showers, isolated thunderstorms at first. Hot with sunny intervals during the day, temperatures up to about 32 degrees. There's a thunderstorm warning effective until 11 o'clock today, and the outlook: hot with sunny intervals and a few showers tomorrow. The showers increasing in the middle of the week. 28 degrees now, humidity 84%.